Welcome to this Clinic Conversation of the Week, a series where we explore how to discuss the latest groundbreaking research with our patients in the clinic. My name is Chris Lieu, and I'm a GI medical oncologist at the University of Colorado Cancer Center. And today, I'd like to discuss the CheckMate 8HW study as if we were having this conversation with a patient in clinic. And so in this CheckMate 8HW study, this is a study of the use of immunotherapy for our patients with metastatic colorectal cancer in a very specific patient population. And that is a patient population that is MSI-High or deficient mismatch repair. And this is simply a biomarker that tells us that the DNA repair mechanism within the colorectal cancer is dysfunctional. Unfortunately, this only represents about 4% of our patient population with metastatic colorectal cancer, but it's really important that we know that this biomarker exists in the patient population that is MSI-High or deficient in mismatch repair, because those patients may respond better to immunotherapy than they do to standard of care chemotherapy. So in this study, the investigators were trying to answer a question. Are two immunotherapy drugs better than one immunotherapy drug? And is immunotherapy just in general, whether it's two drugs or one drug, is that better than standard of care chemotherapy, which is how we typically start treatment for any patient diagnosed with metastatic colorectal cancer? So patients were randomized, and again, they had metastatic colorectal cancer. They had this biomarker called MSI-High or deficient mismatch repair, and they're randomized to receive two immunotherapy drugs, nivolumab and ipilimumab, one immunotherapy drug by itself, nivolumab, or standard of care chemotherapy, and physicians got to choose which chemotherapy they got. We know from the prior reports of the study that immunotherapy, particularly the doublet immunotherapy, nivolumab and ipilimumab, they did better. Those patients receiving that immunotherapy did better than patients receiving chemotherapy. What we didn't know, and what this recent study update showed us, was is two drugs better than one drug when it comes to immunotherapy? So in this study, when we look at the time that it took for a patient's tumor to grow, we call this progression-free survival. How long did it take for a cancer to progress or to grow? We know that at 2 years, the two-drug regimen had a 24-month rate of progression-free survival of 71%. Another way of saying that is that 71% of the patients getting the two drugs of immunotherapy didn't have any tumor growth at 2 years. When we looked at the group of patients that received only one immunotherapy drug, it was only 56% of those patients had a 24-month progression-free survival. And in other words, only 56% of the patients had the tumor not grow within 24 months. When you look at the toxicity of both regimens, you can imagine that the patients getting two immunotherapy drugs had slightly higher rates of side effects that are sometimes related to immunotherapy, whether that's fatigue, diarrhea, or other side effects. But the toxicity between the two groups was relatively similar. And so really what this study showed us, the CheckMate 8HW study really taught us, is that in patients that are able to receive two immunotherapy drugs, nivolumab and ipilimumab, those patients did seem to do better than patients receiving only one drug, the nivolumab alone, or standard of care chemotherapy. And this likely represents the new standard of care for patients that are newly diagnosed with metastatic colorectal cancer and have this biomarker MSI-High or deficient mismatch repair.